Welcome to this video on the essential objectives of access cavity preparation. This crucial step in endodontic treatment lays the foundation for successful root canal therapy. The first step in access cavity preparation is to completely remove all decayed tooth structure. This prevents bacterial contamination and provides a clean foundation for the procedure. To gain access to the root canal system, it is necessary to remove all coronal pulp tissue, both vital and necrotic. This ensures complete debridement of the pulp chamber. Accurate identification and location of all root canal orifices is crucial for successful endodontic treatment. This involves careful examination of the pulp chamber floor to find the entrances to the root canals. The primary goal of access cavity preparation is to gain complete and unobstructed access to the root canal system. This involves removing dental structures that hinder the instrumentation and obturation process. Clear removal of enamel and dentin, ensuring a straight path to the pulp chamber. Adequate access to all root canals, locating and opening all canals, including accessory canals. While it's essential to gain access, it's equally important to conserve as much tooth structure as possible. Excessive removal can weaken the tooth and increase the risk of fractures. Minimal tooth reduction, using conservative techniques to achieve access. Smooth cavity walls, reducing stress concentration and preventing fractures. Creating a straight-line access to the root canals is crucial for efficient instrumentation and obturation. A curved access can hinder the working length determination and increase the risk of file breakage. Removal of any obstructions, eliminating ledges or isthmuses that can cause canal curvature. Proper angulation of the access opening, aligning the access cavity with the root canal system. Good visibility is essential for effective endodontic treatment. The access cavity should allow clear observation of the pulp chamber and root canal orifices. Removal of any debris, ensuring a clean working field for better visualization. Use of magnification, employing dental loupes or microscopes to enhance visibility. Proper access cavity preparation helps minimize procedural errors that can lead to treatment failures. Accurate location of root canals, avoiding perforation or stripping of canal walls. Prevention of instrument breakage, creating a clear path for instruments to navigate. By understanding and achieving these objectives, dentists can establish a solid foundation for successful root canal treatment. Proper access cavity preparation is a critical skill that contributes to patient comfort and long-term dental health. Thank you for watching. If you have any questions or would like to learn